everyone. Welcome to a new episode of our People Power Insights conversations. Today, we are having really amazing guests, and I would like everyone to meet Dr. Stephen Loyd. And especially, Stephen, what we usually do in these first few minutes is ask our guests to imagine if you are walking into a room full of people that you have never met, how are you going to introduce yourself?
Yeah. That's it, Sam. I do that. I do that almost daily. So I always introduce myself as Stephen Loyd. I'm an addiction medicine physician in Tennessee, and I've been in recovery from drug addiction to opioid pain medications for just over 20 years.
Wow. Amazing, Stephen. And one thing that I wanted to ask you, and maybe we can start with this, is when did you decided to go into healthcare, to go into medicine? When did that decision came in your life?
When I was a kid, I grew up in rural Appalachia in the eastern part of the United States, and nobody in my family with my last name had ever graduated from college, and they were all diesel mechanics and blue collar workers, hard workers, and I wanted to go to college and I wanted to be a doctor. I wanted to be able to help people, and that was from about the time I started first or second grade. It was always and I didn't have family that was educated that had ever been to college, and so I remember when I used to tell them I wanted to be a doctor when I was a little boy, and even as I got older into high school, they laughed at me. It almost like it wasn't possible, but no, I've known basically my entire life.
Amazing. Thank you for sharing that with us. One other thing, and there's a follow-up question to that, is you have shared, like you just mentioned here, that it has been over 20 years that you struggle with addiction. And I wonder if you can share with us a little bit about how that personal experience has shaped your approach nowadays to your advocacy and to the work that you do with addiction treatment.
Sam, it's funny. This past week, I was on a text string with some of my high school mates, and hadn't talked to them in a long time, and because they had seen some work that I'm doing about what you and I are going to talk about, and I told them this. I said, "Who in the world would ever thought that addiction would be the greatest thing to ever happen to you in your life?" I got my last day of using was July 8th, 2004, and I felt like the world had crashed and was over. I felt like I had lost everything I'd worked for because I wasn't a kid. I was a grown man. I was already graduated medical school and residency. I had children of my own, and I felt like everything I had worked for was lost. I had no idea that it was the start of the greatest thing to ever happen to me, and so I got world class treatment. And I'm an internal medicine physician is my training. So I worked in the hospitalist ICU medical step down units for, about 15 years in my career. But the addiction changed my focus. And once I went through recovery myself, found recovery, I got very interested in addiction medicine, and I did not want to do anything else, Sam, and really had to figure out how to make a living at it. And then in the process of doing that, I became an advocate for those suffering with addiction because I discovered these two separate treatment worlds out here, how people are treated who have the issues that I do. And so there's this one world where if you have money and resources, you get treated a certain way. And if you have regular insurance and no resources, you get treated another way. And I was never good with that. And I'm not good with that to this day.
Now, when just a minute ago you were mentioning about this conversation with your with former colleagues and how, like, I can just imagine some of that conversation what could happen between that group. And I'm thinking that kind of conversation going on with these people that you haven't met and you haven't seen in a long time, were they like kind of surprised or were they kind of excited or what was their reaction to know what you are doing now?
They're very excited. Of course, they didn't go through it with me, but word of mouth travels, and then I've been really fortunate, Sam, here in the past few years because we've been able to gain some traction with some of the things that we're doing. And I was actually I had a character on a Hulu series portrayed after me. Michael Keaton played I guess me in the Hulu series Dope Sick, which won an Emmy, and Michael Keaton won an Emmy. I didn't win anything, but Michael Keaton did.
Uh,
And so, 21, 22 million people saw that. And then, of course, some newspaper articles were done about it in the state that I live in because, was a doctor from our state, which was me. And so, some of that work started to spread nationally. And, as a result of that, other things happened, things like NBC Nightly News, the Today Show, big shows in the States that I've been on. And so my work became, in this field, fairly well known. I mean, not famous or anything like that, just trying to keep the focus on helping folks. So they knew it, but we hadn't talked about it, and so we actually have our high school reunion coming up next year, which is, one of the reasons we were all talking, and they were just so supportive of the work, particularly the work that we do in jails, which I think is just, some of the best work that I've ever been involved with in my life. And so they're unbelievably supportive. They're proud of me. I know you're not, but it does make me feel good, right? These are my childhood mates, my childhood friends, and
Of course.
so just unbelievably supportive. And the truth is, Sam, most people have been really throughout my career. Right when I came back from treatment and got back into medicine, people were unbelievably supportive and wanted to know what they could do to help me. So I really have had a road that's been paved by people who were supportive and wanted to make sure that I had the tools I needed to succeed.
Amazing. No, no, no. And I haven't seen the series, the whole series, but I want to take a look at it because I learned about that character being inspired in you. And again, congratulations for all the amazing job that you have been able to do so far. And I'm sure that there are even more amazing things coming up. But let's move on and talk a little bit about the specific work that you do. It's related to this huge crisis that we are facing, the opioid crisis. And there are some people that like when you read about it, when you try to learn more about this, there are different point of views about how to approach this crisis. And some people talk and discuss about how an approach that may work is related to stigma to deter use. But I know that you have a very strong point of view about that. So I'm curious to hear about that. How do you think that that kind of stigma or social pressure, those things work in this setting?
Sam, it's the biggest single barrier we have to people getting help. Now, and you know this as well as I do. You always need money and resources, right? I mean, you just do. The world costs money, but the biggest thing that prevents people from getting help is the stigma related to addiction. And anytime I get done with the talk, like in Providence, Rhode Island, just yesterday, was talking about that. People say, "What can I do?" I said, "I'm going to give you something that you can do that doesn't cost anybody any money. We don't need a grant. We don't need some kind of federal or state program. This costs no money." I said, "You can change the views that you have towards people with addiction." And we can all do that. It's the single biggest barrier. I'm on this podcast with you right now because of my role as an advocate. And I have no training in it whatsoever. I've always been a student of civil rights in the United States. And so, one of my heroes is Martin Luther King and Fred Shuttlesworth and John Lewis, some of the giants for me in the civil rights movement in the 1960s in the States. And I watched them advocate for rights for really an unpopular cause, right? I mean, most of the South wanted to keep blacks where they were, quote, in their place, unquote, and just really have taken a lot of heart in reading and learning about how they brought that to the national conscious, to the national attention, through things that happened at Selma, Alabama, and Birmingham, Alabama, Jackson, Mississippi. And I'm not equating this with the severity of the civil rights movement. Don't get me wrong, but there's a lot of similarities, and it seems like there's a lot of people out there that think, well, these people have addiction, they brought it on themselves, so we can treat them any way they want to. And the weird thing about that, Sam, is a lot of times the loudest voices for that are coming out of organized religion and the church.
Yeah.
And I'll tell you this is just my views. I'm a Christian. And the teachings of Jesus were about love, kindness, compassion, understanding. And when Jesus said he was asked what the greatest commandments were. He said, well, love your, Lord your God with all your heart, mind, and soul. But the second is to love your neighbor.
Yeah.
I mean, that's coming from the man, right? And if you look at, Hindu and Buddhism, Muslim, all of those religions, they all have one thing in common, and that's to love your neighbor. And so I see so much of this stigma brought about by views of people who purport to be part of organized religion.
Yes, and no, no, I completely agree with that, and I can see that too. And I mean, going back, as you mentioned, to what Jesus said, he was always there sitting and having lunch with these people, and he was not stigmatizing anyone. So yeah, there are a couple of things that people now could learn about how to work and to live their lives.
I just made the decision for me because I used to get into it and I wanted to fight. And I said that. And when I said what I just said, that's not everybody. And matter of fact, it's a vocal minority because I've worked in this field and part of my advocacy has been in people that have a spiritual component of their life, and no matter what that is. And I've just been amazed at their willingness to open their minds and start to meet people where they are once they learn. And so I've really taken an education approach to my advocacy. The hardest thing for me times is to not want to fight and get down on that level, right? Because it's so difficult not to. And it's the thing that amazes me about Dr. King so much with the nonviolent methods, and the freedom rides, and that actually a lot of them originated here in where I live in Nashville, and they were able to take all of that hate coming at them, and I've had that spewed at me, I promise you, and not react to it in a violent way, and that gets people's attention. And I don't do it for that reason. I do it for the reason that when I react that way that it's thrown at me, I feel bad. I don't like me, but I'm not telling you it's easy. It is very difficult, and I know some of the work that your friends have been involved in, and much more severe than what I'm talking about. But then when I talk to them now and hear what their approach was and hear where they are now, I mean, these are people that are at peace with themselves, and that's what I strive to be as we go through this.
Yeah, that's right, Stephen. And one thing that I want to ask you, I have seen and heard some of your other like interviews and media appearances, and you often emphasize the importance of community and relationships. Can we discuss maybe a minute here? What's your point of view here, and what are some key aspects that these relate with recovery?
Yeah. So a lot of times when you're looking at, and you've already mentioned it, Sam, earlier, when you're looking at addiction, people have different viewpoints on it and different ways that they think people can get better. And addiction is just like any other medical condition. It's a disorder of the brain. It's highly treatable, and people recover. And you're looking at one of them. There's more people living in recovery in the United States today that are living in active addiction. People don't understand that. But when you start to look at some of the ways you get there, people have very, very strong thoughts about it. Well, you need medication, so you're not really in recovery. Or if you're on medication, we're not going to allow you to do this or do that. And those things are incredibly stigmatizing, and there's no evidence, to support them. And so what I try to do is just keep my focus on people getting better, no matter the route. And we talk about it here where I'm sitting, physically right now in our practices. We want to demonstrate mercy. We want to forgive habitually, and we want to do that all the time. We want to love people unconditionally, and so we bring forth those things. Now, in the process of that, we have to give them tools to be able to go forward in their lives. And so the thing that I have to have people understand is that there's multiple paths to recovery. What worked for me was completely abstinence based. It was a spiritual based program that I still participate in today, and it saved my life, Sam. Right? That's why I'm talking to you right now. Other people can't do that, right? And so they need other routes to their recovery, and it's no different than any other disease out there, right? If we look at high
Yeah,
blood, right? How many high blood pressure medicines are on the market? Right. I mean, there's a ton of them because people don't always respond to the same treatment modality. And so part of our work is to get people to that.
exactly. No, no, no. And I love that comparison because that's completely right. Now, Stephen, another question here that I want to ask you is that we have seen that despite recent efforts, opioid-related deaths are continuing to rise. So, in your opinion, what policies do you believe are failing us? And what changes at a policy level we could do to address this?
Right. So those are tricky questions because when you get into this, when you look, get into policies that are failing us, you get into blame, right? And pointing fingers. And I'll try my best not to do that. I can tell you that things that I think work going forward. And it's pretty simple. Number one, harm reduction principles. The first thing we have to do is, and that this is after the stigma thing, right? The stigma is so big. I mean, it's massive. So after that, harm reduction principles, we have to keep people alive, right? I mean, that's a fact. So I tell people all the time, I'm an internist by training. I can't treat dead people. I haven't figured out how to do that. So we have to keep people alive, and we have to keep them as disease free from infectious diseases as possible. So that's why things like overdose reversal programs being widespread and available, clean syringe programs, so that we don't transmit hepatitis C and HIV disease, right? And then those things are up front, and they need to be linked to treat, Sam. So I'm going to use you as an example. Sam can come to
Yeah.
me dose, right, and I reverse him with one of the overdose reversal drugs, and Sam wakes up, right, and we really brought him back from the dead, and we just send him out the door. We didn't do anything to help him with the underlying reason he was there. So these harm reduction programs need to be linked to treatment, and that treatment needs to be treatment that's individualized with the patient who's right in front of us. It needs to be for their needs, not whatever the program they get sent to happens to provide. And I think these are some of the shortcomings that we currently see. You can get sent to places that doesn't believe in this or doesn't believe in that. Well, what if the things they don't believe in is your path to recovery? Well, guess what? You're out of luck. And I don't know of any other area of medicine like this. We really have to focus on people in jails, prisons, and hospital emergency departments. These are the folks that are at highest risk. People who are unhoused, living on the streets, figuring out a way to get to them and realize that we have to have tools in place for them, not the least of which is stable housing and a way to start to provide for themselves. So these are social determinants of health. And we're already spending a lot of money in these areas. And I think that we can redirect some of those funds to help folks. And when people hear me, they say, "Oh, we can't afford this, we can't afford that." I tell them all the time, we're already spending the money, Sam. We're just spending it in the Department of Corrections. And you know this, you're in Mexico. And most people around the world would probably say, "Oh, well, Mexico, that's a violent place. They probably imprison more people than anywhere else in the world." And they don't. It's the United
Yeah.
States. And it's really not even a close second to us. So if imprisoning people worked, we would be in great shape, and we're not. So I think we have to take a look at those things. And then on the back end of it, we have to look at what are our outcomes. Addiction treatment is one of the only fields of medicine I know where we don't measure outcomes. We pat ourselves on the back when we got somebody into treatment, and we did a physical exam on them in 24 to 48 hours, and we did an addiction severity index. Well, all those things are important, Sam, but it doesn't make any difference if they stick a needle in their arm 20 seconds after they walk out the door. Okay, I want to look at outcomes, and I want to measure outcomes. I want to define what the metrics for success are, and then I want to appropriate our funding to things that work. We absolutely have to talk about prevention. That's the biggest bang for our buck. I think, from the public health fields, for every $1 invested in prevention, you got about an $11 return on your investment. That's a pretty good return.
Wow.
So we have
Yeah.
to look at evidence-based prevention programs that are targeting kids early. And when I say early, I mean elementary school. And they're out there. They need to be widespread. And last but not least, we have to utilize people with lived experience. And so when I look at my role and the things I do, I'm the chair of the Opioid Abatement Council in the state that I live in Tennessee. I'm the director of the Office of Drug Control Policy in the state of West Virginia. But I had a what I'm going to say, pretty highbrow approach to my addiction, right? I got the best. Most people don't get that. Most people have to be incarcerated. They run into trouble with the criminal justice system. They don't have a driver's license. They have faced housing instability. We have to involve people with lived experience in the real world to help us fill these gaps. And I think, if you numbered those out, that's about a 5-step approach. And you and I covered it, in about 3 minutes. And of course, there's a lot of meat on that bone, but I think it's rational, and I haven't seen anybody lay out a roadmap.
You just mentioned we have to involve people, Stephen, and I completely agree with that. And actually, I want to follow up in that quote because we are both physicians, and we have a lot of colleagues, like other clinicians, other healthcare providers, staff that we want to make sure that people do what is needed, right? And some of these colleagues may come to you and ask you, Stephen, what can I do? How can I advocate? And you just mentioned that you heard this yesterday, and I'm sure you hear this every single time that you are speaking in a group. So, what can you tell to other clinicians that want to work and want to address this?
Well, the first thing I would tell you this, and I didn't answer your previous question very well about community and relationship, but this is community and relationship, and I talk about it all the time. The opposite of addiction is not recovery. I love recovery. I found recovery through community and relationship. And look at what we do as physicians. Sam, you know this. Our relationships with our patients, they are personal, right? I mean, we keep it at a professional level, but we have a connection to our patients. We know what they do in their lives. A lot of times we know their kids, we know their hurts, we know the things they struggle with. And when you have somebody step into that and meet you there, and I may not be able to do it, I may not be able to do anything about the things that have hurt you in your past, but I'm there engaging you in a relationship. That's massive. And if you don't believe how massive it is, look at funerals. Why do people go to funerals? You're not going to bring anybody back from the dead, okay? But it's about that community and that relationship and that support that helps us heal. And so I think that this is the perfect example of that. And so my colleagues out there, and you know this, Sam, you know what we got in our medical training on addiction, right? You know what we got in our medical training on the proper prescribing a controlled substance. So we almost nothing, right? So there's an education component to it. And then there's an education component of what is addiction? What happens in our brain? What are the things that we lose access to that we really rely on to get through our day? And then how does that come back over time as we start the recovery process? And I think Christians need to understand that, because I still think that the white coat is respected. And I think that people still respect it and they still look up to it. And I think that physicians can lead this, which is what I've tried to do as a physician. Now, I don't dress like a normal physician anymore, mainly because of the population that I work with. But I can tell you, when I'm in front of audiences having MD after my name and some of the things I say, they're looked at differently than if somebody else says them. And I don't mean that in an arrogant way. It just is what it is, because they respect that those clinicians educate ourselves, be able to identify it, right? I think that's important. And even if we don't know what to do about it, because I mean, the truth is, I don't know how to treat head and neck cancer, but I know some oncologists who do, and I know some radiation oncologists who do. Educating ourselves on the fact of, one, being able to realize the risk factors of it so that we don't intentionally set somebody on that road with things we prescribe. Two, become an advocate for those who have addiction to get the treatment that's right for them. And then three, be able to make proper referrals so that people can get help. And then lastly, be willing to take those patients back and help them on their continuing journey like we do every other chronic disease.
Yeah, no, thank you. And I love how you mentioned three clear steps that everyone can follow and get involved. Now, Stephen, we know that we are working and walking towards a goal. Like, and that goal is not like, maybe we are not going to be there in 1 or 2 years. It may take us more than that to get to that year when the crisis is gone. But what do you envision for the future of treatment and prevention? What are some of the steps that, as a community and as a health system, we can start moving towards there?
Well, I think we're already seeing it. You know, in my work in this field, I've been an advocate for almost 20 years, but the advocacy work intensified greatly around 2014 because of some really good things that happened to me, and I happened to, have a platform and a voice. And I can't emphasize enough how much it changed in 10 years, because sometimes I think it hasn't changed at all. And then when I look at it, I'm like, Steve, it's really different now. And it is. And so I think those things are going to continue to happen. I think the biggest opportunity we have right now, particularly in the United States, is this is a campaign issue. We have two candidates running for president, both who have been affected by addiction. Former President Trump's brother, died of his addiction to alcohol. Vice President Harris and the first gentleman have been affected by addiction in their family and their circle of friends. And so I think we've got a unique opportunity from the highest levels of politics in the United States. If you look at former President Trump's running mate, vice presidential candidate J.D. Vance, grew up in Appalachia. He had a mom who was addicted to pain pills. And it's really how Senator Vance gained notoriety with the book that he wrote called Hillbilly Elegy about his experience. And so I hate to see political mud thrown on that because this is a bipartisan issue. And I think we've got a unique opportunity in the United States right now to set the course going forward. And I think that direction needs to come from the Office of National Drug Control Policy in Washington. We can't tell individual communities around the country exactly what they need to do because they know their needs. But what we can do is give them guidance and a roadmap that I've already laid out for you on how to approach this. And I think that if we get serious about using data and analytics, and I'm particularly interested in machine learning to help us better allocate dollars and measure outcomes, and I think we're going to discover that there are things related to better outcomes that we're not even aware of yet. I mean, that's the advantage that machine learning gives you. And so I'm really hopeful for all of that because of the political climate. And we have opioid settlement dollars that are floating around the United States in most every state. And it's well over $60 billion. And I think that will continue to grow. So now we're looking at meaningful resources to start to build this system of care. My fear is, Sam, and I'm not a naysayer. You can probably already tell that. But my fear is that we don't have a unified approach and direction from people who understand a little bit. I don't understand everything, but there's people out there who understand way more than me. But if we don't have guidance from that, I think we're at big time risk of misusing this money and missing an opportunity.
Yes, and that was actually one of my last questions related to these settlements amount of money that are being like directed to states. And I know that you have been directly involved with some of how that is allocated in your state. And are there things, Stephen, that other places of the US could learn from the experience in Tennessee and in some other states?
Well, I think there's a lot of states that are doing some really good things, and so I think that we need to get the people leading these efforts in these states together in the same room because I love cross pollination of ideas. And Sam, I'm a guy that I don't sit in my office on Zoom calls, although that's what basically what you and I are doing right now. But I get out in the community and I get out in the United States and I meet people and I take ideas from them that are working in their states and look and see how I can apply them or help apply them in Tennessee and now West Virginia. So yes, I mean I think those things are things that are desperately needed is this cross pollination of ideas. And then we have, the big thing is we've got to have the courage to measure it. Well, sometimes we want to pat ourselves on the back and we've done a great job. We've put X number of doses of overdose reversal drugs out in our community. I want to know how many of those people that we reversed sought help, got treatment, are in recovery. Because that's the only thing, and it's going to take some courage to do that because you have to start to look. And it's one of the things I learned in recovery, Sam. And so much of my practice of medicine now is about my recovery. And I learned this in recovery. When I have a problem, most of the time, the cause of it is looking at me in the mirror, almost always. Sometimes it's out here, but that's a small percentage. We have to be willing to look at ourselves. We have to be looking at what we're doing. We have to face what our reality is, what our successes are, what our failures are, and be able to adjust on that. And I'll tell you this because I love it so much, and I'm glad I'm going to get to work it in right here. I'm a firm believer in the Stockdale paradox. Have you ever heard of it? Okay. So
Uh, go ahead.
Admiral Bell was a Medal of Honor winner. He was also Ross Perot's running mate back in the day in 92.
Mm.
But Stockdale talks about this. He says, we must confront the most brutal facts of our current reality, whatever they might be. And I do that. We have to look at that. He said, while at the same time retaining faith that we will prevail in the end, regardless of the difficulty. And that's the approach that I've taken to the opioid crisis. And the thing that I've seen is it's really hard to take a look at our current reality because the tendency is to want to turn around and start blaming people for that reality. The court system will take care of that. Okay. I don't have to worry about that. What I have to worry about is keeping my eyes on the things that are going to help the most number of people going forward. And then what are the steps we need to take to get there? And I don't have those answers, but I think those answers are in the collective brains of people in this country.
Wow, Stephen, that's an amazing way and an inspiring way to start to close this conversation, to wrap up this conversation. I want to thank you for your time, for the opportunity of having this conversation. And finally, in the last few minutes before we finish the call, we usually ask our guests some like rapid questions, asking them for a short reply, and let's just see how it goes because I usually love these short questions, short answers. So, first one, what is book that you love and that you will recommend for people to take a look at and read?
For what? The opioid crisis?
Yeah, for people that want to get involved
Okay.
in the work.
So there's actually two. One is called Dope Sick by Beth Macy, and the other one is by Sam Quinones. And Sam Quinones writes, it's called Dreamland. And Sam Quinones writes about the transition from prescription pills to heroin. I think those are two good books to start with to start to get an understanding of how this has unfolded in the United States. And Empire of Pain by Patrick Radden Keefe is a must read to understand the corporate greed behind the opioid crisis. So I gave you three.
Thank you, Steven. Second question: is there any other media like a movie or a series, and I think one that you could mention here, but that you would recommend people to look at?
Well, I'll toot our own horn here. The Hulu series Dope, which by the way, I don't have any financial interest in. I didn't get paid, and I don't get royalties or anything like that. So I think the Hulu series Dope is really good because of its depiction of a doctor who gets addicted himself and then practicing medicine in rural West Virginia. I think it does an outstanding job, and so do people who give awards for that. It was Emmy nominated and is an Emmy award winner. And then I also very much enjoyed a Painkiller. I thought that was a really good depiction as well.
Thank you, Steven. And another question here: some music that you like to hear. What music does Stephen loves?
Well, I'm in Music City, USA, right? So I'm in Nashville,
All right.
Tennessee, and there are some great recovery music out there. One of my favorites right now is an artist, Jelly Roll, who is internationally known now, who recently testified before Congress in very powerful testimony about his own struggles with addiction. And so Jelly Roll is one of my favorites. And then from a bluegrass standpoint, Billy Strings. Billy Strings writes really good music around substance use and recovery. So those are two of my favorites right now.
Amazing. And final question, Stephen. If you could meet and have a cup of coffee or tea with someone, anyone, dead or alive, from the history of the world, who would that be and why?
Martin Luther King. I want to know how he kept the energy to do what he did for so long in the face of the obstacles that he faced every day. And I continue to be blown away by that. I get so beat down, and I don't face 1/millionth of what Dr. King faced. And so that would be that.
Thank you, Stephen, really for this amazing conversation. I need to be honest here, one of my favorite conversations so far of all the ones that I have done. Thank you for your time. And I wonder, you have one last comment for people that are watching this video?
I do, and I try to always talk about this. Addiction's treatable, treatment works, and people recover. Those are facts.
Thank you, Stephen. Thank you. And thank you, everyone, for joining us in a new episode of our series. I will see you all next time.
Thanks, Sam.